the presentations, time is not on our side.
But you're meant to be on my panel. You're doing a presentation on my panel. What topic are you taking?
The nexus between employee wellness and safety.
Okay. All right. Allow me to call upon Mr. Miles Jacob to take us through the nexus between. He's taking us through the nexus between workplace safety culture and employee health and wellness. So we'll allow him to do the presentation. Just after his presentation, we have a reaction with him, and then we proceed to the next presenter. Over to you.
Right, guys, I don't want to see empty seats unless if it's the reserved seats. Anyone who has a laptop, please switch it off. You won't be needing it today in this presentation. Those who are wearing heels, please take them off and keep them close to you. So I'm giving you 1 second. Switch off your laptops, take off your heels, and keep them close to you. Please, can I have a mic? Yes, I'm going. Am I getting my presentation on there? Can I have the presentation on there, please? Hello? So while we wait for the presentation, I'm going to be looking, nexus is just a big word. That means connection. So the connection between health and safety and employee health and wellness. And you can't separate the two. Safety, which is the condition of being safe, and wellness, which is the quality of your health. Everyone stand up, please. Stand up, quickly. Stand up and be quiet. Raise both your hands, please. Both your hands up unless if you... Yes. Put them down. Look left. Look right. Look up. Look down. Sit down. Stand up. Right, I want you to do the opposite of what I tell you to do. If you don't do it, then you are doing push-ups and sit-ups and jumping up and down. Do the opposite of what I tell you to do. Hands up. Hands up. Hands down. Sit up. Sit up. Sit up. Dog, where, excuse me, where, quickly, and that time, in 30 minutes, where, quickly, where, right, look up, look down, look left, look right, hands down, hands up, sit down, stand up. Well done, guys, well done. I'm still waiting for my presentation. Is it coming or is it not coming? Right, so do I have to go without the thing? Right, so the first thing with health and wellness, it has to be a calling, okay? It has to be a calling. You have to love people. Miles Jacob, employing nexus between. You have to love people. Because you are going to do more than what you're supposed to do. So you have to enjoy human beings. I'm a student of humankind. I love human beings. Because you have to do more than what you're supposed to do. Okay? So most of you guys here, some of the guys, I know them, representatives, managers, HR, I don't know who's here, but you're in charge of a group of people. And you have to love human beings. Because it must be like a calling. Most organizations that we go, people don't really are not concerned about the employee wellness of the wellness of their employees. And I will say it now because I'm open and blank and blunt like that. Miles, what's that? Some wearing heels like this, just do what you can with them. And you're the one who called me. So you have to, rule number one, you have to love human beings. The second thing is physical fitness forms a big part of health and safety in the workplace. You cannot carry out procedures when you are not physically fit. All those safety procedures we were learning and all this safety stuff that I was hearing about, you cannot implement those unless you are physically fit. So what we're going to do today is very simple. Whenever I say change position, it means you have to move from where you are sitting and sit somewhere else. If you are still standing in 5 seconds, you are going to do star jumps. Change position. DJ. 5, 4, 3, 2, 1. Stop. DJ Ukurara. You're too slow. So the first thing is physical fitness. Physical fitness has many aspects. People have to be physically fit to be able to carry out these procedures. Guys, pay attention, pay attention. I have 30 minutes. I asked for 2 hours in the Kapua 30. Right. So you have to be physically fit. There are many aspects of fitness. I go to organizations, they say, Takatuita wellness, what did you do? Takaita Zumba. What's that? That's not employee wellness. That's just a fraction. We did Zumba. For what? Ma'am, please come here. And the person next to you, and you, come here quickly. Stand here like you're about to do Zumba. Quickly, face me. Stand. So you guys called, face me. Right, so you guys called me. You said, Tagwita wellness, Tagwita Zumba. Right? Go 2 behind, 2 in front. And the guy next to you. Go. I can see your face is talking to me. Quickly. Right, so you have 4 people here. You call Miles and say, Miles, Tagwita Zumba, no employee wellness. Miles will come there. DJ, play something. Quickly. So Miles will start, join me. Tagwita Zumba. Right, stop. Mem Madamombe, stop. Don't do what I'm doing. Mem Priska, do something completely opposite. DJ, let's go. Zumba. You see what is happening? Stop. I cannot stop 140 people because of Mem Madamombe Barubeka. Those are the disadvantages of group fitness. I cannot stop everything because of Mem Priska. Yes, I cannot stop that. And she can get herself injured. Easy. And never come back again. Clap hands for them. Go and sit. Change position. DJ. 5, 4, 3, 2, 1. Stop. If you are standing, ma'am, you are standing. Come here. Come here. Look at them. I want you to do 10 jumping jacks. You know jumping jacks? These ones. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9. Well done. Clap hands for her. So physical fitness has many aspects. Please, employee wellness has so many aspects to them. So you have to make sure you are covering everyone. In organizations, Panongon's wellness, there's people who already do it. There's the first wellness session. So employee Zumba and exercise is just a small part, but it helps. So you need people to be physically fit because their physical fitness affects your safety procedures, affects them at home as well. If you're not physically fit, can you perform in bed? Honestly. All men stand up here. Stand up. Men, stand up. Men, stand up quickly. Right, I'm going to tell you something very honest with you. You don't need gadgets or anything to understand where your fitness levels are. If you are male, and you stand like this, the way I am, everyone face that side. That side. Look down on yourself. If you are male and you are able-bodied with no condition, and if you look down and you can't see where your manhood starts, go to the gym. Okay? That is not science. Sit down, guys. If you look that side, when you're doing your wee, and you can't see where it starts, you are in trouble. There are people who go for years without seeing their manhood. I'll go in the toilet, I'll go talk as well. Then that's it. Change position. 5, 4, 3, 2, 1. DJ, you're sleeping. Change position. 5, 4, 3, 2, 1. So physical fitness is very important. It's unfortunate that I've been deprived of my presentation. I went for lunch. DJ, stop. Oh, it's there now. Okay. Right, let's go to the next slide. Stop there. There goes the devil. I was watching people eating, and I like to observe people. I was watching people eating. Do you know that the most excited person on this planet, if he is a person, or if he is a he, is the devil? The devil doesn't do much anymore because you are killing yourselves with food. He knows. I've been to Sunday, I've been driving around areas of interest. You see people full of the Holy Spirit, they are packed in chicken in. After church, steers, pizza in, whatever it is, destroying your body with the food that you eat. So there's no employee wellness program without nutrition, diet, and weight management. You've heard of the term, you are what you eat. There is food that makes you down. There is food that improves your mood. There is food that makes you, for every pregnant people eat different types of food. There is food for sexual performance. Some people come to me and say, problem, it's not working in bed. After eating 3 loaves and potatoes, you want to go and sleep with someone. It's not possible. It's not possible at all. So with employee wellness, nutrition, diet, and weight management becomes a very important component. So now we have physical activity, and then we have nutrition, diet, and weight management. That should never lack in any employee wellness program. We understand each other. How can people perform? How can people observe protocol in health and safety when they are hungry or when they don't know what they're supposed to be eating? I told people 2 years ago, I said, this year is going to be the most challenging as far as mental health is concerned. Stress, anxiety, depression, substance abuse, burnout. Because we have not recovered from COVID yet. Everyone in here lost someone or was affected by what happened with COVID. We have not recovered as a people. And we have our own problems, economic problems, whatever problems. We have so many problems. I can even see, I can tell this one is just dressed nicely, eyelashes, wow. But they are dead. People are walking dead. Heels, makeup, whatever. I can tell that there's nothing happening here. People have, brain is messed up. We are dealing with so many things. And imagine someone who's working in a factory where they have to pay attention and concentrate. Up like that. And then people will say, at our workplace we have a stress management workshop. Change position. 5, 4, 3, 2, 1, stop. Thank you, DJ. Have you ever met someone who is really stressed and anxious, and you sit them in a boardroom and you tell them, you must breathe nicely, take meditation. Have you ever, Someone who's processing school fees, what, Jolo, all kinds of things in their head. Change position. 5, 4, 3, 2, 1. Right, let's go next slide. Let's see what. Let's go back a bit. Go back a bit. Go back a bit. Right, so we've done that. Let's go to the next slide. Right, leave it on. Go again. Right, so we're still on the components. So there are many components that form an effective employee wellness program. Nutrition, diet, and weight management. Physical activity. Stress. And stress management. Mental health in general. Stress, anxiety, depression, burnout, substance abuse. My colleague, I'm sure, will work on that as well. And then we've got other things that you can add to your program. Things like grooming etiquette and professionalism. Those things go under your employee wellness programs. I've been to organizations where I've been called to teach a CEO or to teach a manager how to dress, how to take a shower. Right now, as I'm talking, right now as we are talking right now, I am 100% sure there is someone who's going to go back where they are sleeping and sleep without bathing. If you are going to go to bed without bathing right now, you need prayer. Change position, change position. 5, 4, 3, 2, 1. You guys are in front. You guys take the forefront. You are in charge of a number of people. It has to be an example. They have to look up to you. Be clean. Shaved. Everywhere. Shave everything. Be clean. Because when you're clean, you're confident. Even the way you walk, you're confident. Your posture is right, chest out, everything is okay. Because you know I'm clean. Right now, if I say, let's take off our trousers. 2 years without buying underwear for yourself. 3 years. If you meet someone who wants to make love to you there and there, you'll be like, wait a minute, wait. Then you come back and you have taken off the thing. Change position. 5, 4, 3, 2, 1. Stop. Right. So you've got your nutrition, physical activity, self-development. You can add time management there. You can add pre-retirement there. You can also add those things. Hygiene is important. I had 2 very serious incidents. I almost had one today. There are people who knew that they should wash their hands because of COVID. I was at Holiday Inn in town there. Very nice looking men. Shaved, nice. They are going. The toilet at Holiday Inn is there by the door. Where are you going? Wash your hands. So cleanliness is like that. People, all these employees back and colleagues back at the factory or back where you guys came from, they will copy from the way you're carrying yourself. When I started wellness, I couldn't do certain things because my clients were next door to me. I had a friend called Adi who used to buy all the unhealthy food for me. Because every time I walk in the shop, I had clients everywhere. They'll be calling me, what is in his trolley? What is in his trolley? I can't buy certain things. I have to tell them, buy this for me, my friend, so I can eat it. But as time went on, I also let go of those things. So don't tell people you are doing employee wellness when you're doing team building once a year. When you're doing one wellness day. One wellness day. Can you really go back to finance and say, guys, we want a wellness day. We did wellness day last year. And these are the results. Can you pinpoint results? This is a culture, a lifestyle, a habit. You won't get results in a one-night stand like a wellness day. It's not working. And I don't even take. Right now, people say, come to our company. I'm like, unless if you are starting for the first time, or maybe we've implemented some EAPs, which are your employee assistance programs, where we know that there's something happening all the time. So we can measure. We can measure what's going on. You have to be able to go to finance. You'll be saying, most of you, and I'm looking at you, and you know who I'm looking at. You'll be like, what are you saying? Can you show finance how your people changed? You affected absenteeism. There's low absenteeism. There's high morale in the workplace. There's all kinds of things that are happening positively. High productivity. Because of Wellness Day, I get 100 miles last year, but 1. Change position. 5, 4, 3, 2, 1. Stop. Let's go to the next slide, please. Next slide, quickly. I think I have like 10 minutes left. Let's go. Right, stop there. Go back to strategies for integration. There are different ways and strategies you can take. But like I said, number one, wellness days don't work. They are just there to impress the boss. It's the first time to meet a wellness day, but you can't carry on doing wellness days. There's something that we call well-being washing. And it's very evident in the public sector. Somehow you get a bonus for doing a wellness day or doing wellness at your workplace. We call that well-being washing. You are doing it to tick a box. It has repelling effect, unbelievable effect. It is negative. You can't do wellness to tick a box. Because the people who come and say, there's a big organization, we did wellness, we went throughout the provinces, and then it just stopped. People now call me and say, so you wanted to use us. So you connived with the organization. Why have you stopped? Because we thought we were going on a journey together. And then all of a sudden, it's like making love to a woman. And some of you men here are guilty of that as well. You buy champagne, some grapes, whipped cream, you dim the lights. Oh, by the way, it's Breast Cancer Month. We are commemorating that. Women, please. Breast cancer is real. We also have breast cancer for men. So the reason why we are wearing these things is not for decoration. It's Breast Cancer Month. Men, there is a considerable number of cases where men discover what's going on. When you are making love to your woman, take your time with the breast. If you feel something, tell her. So many cases that don't just go straight down there. Touch. Change position. 5, 4, 3, 2, 1. Change position. 5, 4, 3, 2, 1. Okay. Let's go to the next slide. I have 5 minutes left. Benefits are, we all know the benefits. We all know the benefits of employee wellness. But the problem is, if you got the structure right, if you got the program right, one of the most challenges that we face in integration, can you go where it says challenges, please, the guy with the, one of the most biggest problems is, with any program, like what Mem Priska was saying, it starts from the top. Let me tell you and be honest with you. The people that you leave in the office when you're doing an employee wellness program or wellness day, whatever it is you're doing, are the ones who need help. In my experience, the guys are not that my office, I have reports, I have this. They are the ones who need those programs. Don't just attract the guys who are going to the gym or whatever. And please, you guys, if you can afford the gym, if you can afford to exercise, it doesn't mean your colleagues and your employees can. I've been to places where even the she'll be like, but I jog every day, so we don't need the wellness. It's for you, not the rest of the team. The benefits are numerous. And you know the exciting part about employee health and wellness, it also touches outside the workplace. So for example, we can have everything. Let's say we are one organization right now. And let's call ourselves X Limited or XP Limited. And we have implemented everything possible, like Mem was talking about, and the company is productive. We have employee wellness programs that are working. Everything is smooth. But I'm not happy with my relationship at home. Will I perform at work? If my dad is suffering from trying to lower blood pressure at home, will I be happy at work? If I'm not getting enough sex at home, change position. 5, 4, 3, 2, 1. You see, I love people. I love black people. I love it. I love white color. I just love people. Because they can show you what's going on. Right now, by looking at your face, I can tell who's getting and who's not getting it at home. It's easy. It's very easy. Even at work, women, at work, people who sing about the stapler and staple pins. They'll come to your office, stapler and staple pins, stapler and staple. Then you know that something happened. Even a bus driver, my uncle is a bus driver. He told me, hey, man, hey, I get home, I'm tired. She's not giving me anything. I was like, do A, B, C, D. The day that I was even going with him to Mure was there. Hey, good to say you. So morale is important in the workplace. If you get it, you perform better, right? But if you're not physically fit, you can't perform. If your stomach is way there are women who have back problems. Because, number one, you can't change position. You have to do one position. The husband will come and lift the stomach and put it on the back there. That's the only way that they can do what they're doing. And the wife complains of backache because of the stomach is resting on the back. Change position. 5, 4, 3, 2, 1. Stop. So, these problems, if they are relationship coaching, we have it in our wellness programs. Because we know relationships matter. With the people at work, with people at home, people carry problems. There are people who take what's going on at home, they bring it at work. Like Mem was saying, you can tell, Mem Priska was saying, you can tell that they had an argument with the wife or the husband. The people who take what is inside the workplace, they take it at home. Right now, I know someone is going to say, Baba man, hey, pane murumanonzi Miles akarepa so, hey, anga achinakidza. Iwe. Anganakidza chi. Say he was talking about wellness, learn how to speak. He was talking about wellness like this, like this. No, say, akarepa anga achitonakidza. Anga achinakidza. So words are important. Manage how you say things. Even when we do those health checks, sometimes we go with our scales and we're doing your blood pressure, we are doing your waist to hip ratio. You hear the she manager saying, you can't say things like that. You can't say. I have a client in Swaziland right now. She was in a relationship and she caught the husband with another lady in bed. The husband retaliated and said, I don't have sex with you because you stink. You smell. It's not, she got, that guy passed on. And then she got another husband. Very good guy. He said, Miles, my car is like a pharmacy. It's like a bathroom. Every time I just feel like I'm stinking. She has roll-ons, everything. Every time she's working, she runs and checks herself. Because it never left her. So be careful the words that you use with the other colleagues. Most of you are contributing to the stress and anxiety and depression because of how you speak to these guys. There are things you say and there are things you don't say. And there is a time for everything. Know the right time to say the right things. I wonder what the rate is. Change position. 5, 4, 3, 2, 1. Stop. Let's go. What slide have I left there? I think I've got 1 minute left. What slide have I left there? Conclusion is not important. That is not important. That is not important. Go back. Go back. Go back. Go back. Let's see if we skipped something. Right. So that's pretty much. Let's go back. Right. So guys, please, talk is cheap. Talk is cheap. Time and a place for everything. I got 92% in physics in A-level exam just before the final exams. I took my 92%. I ran to my mom. She said, back then, rice was a big thing. Like, we're cooking rice today. I did well. If you can get 92% physics before the exams, the final exams, I'm happy. I'm sure you get an A. But when your father comes, don't tell him. I'll tell you when to tell him. Mina. Soon as my dad drove in, I ran with the 92, and I will never forget this. Did 92%. What's wrong? I'm going to 92, not going to 100. The wrong timing. My mama, I told you wait. I know when you can say these things. So be careful, learn. Most of you are promoted because you can hit targets, not because you know how to deal with people. So make an effort on your own to learn people, love people, go the extra mile. And employee wellness programs, they don't need money all the time. Create a wellness committee. Come, we train you how to implement the programs tailor-made to your people, to your organization. We can't waste time with back and neck when the whole organization is always running around. But if you have drivers, if you have people sitting down, we implement a back and neck program at your organization. So it's tailor-made. It's not a one-size-fits-all. So I hope that I'll get more time before Saturday. We can even stay here till Sunday. But I'll stop now.
Thank you so much, Miles Jacob, for taking us through the nexus between workplace safety, culture, and employee health and wellness. I'm sure the practicality and the examples that he was bringing into the house were more close to reality that we could almost give him the whole session. But the key takeaways have to be remembered always, that wellness has to be a calling. If it's not a calling, then you are likely to deal with human beings wrongly. Safety needs physical fitness. One wellness day, that is my main key takeaway. One wellness day within our organization is of no significance of value. We really need to introspect as the Sheikh representatives here present, managers, and all participants of decision making in this room on how best we can put to practice the safety and health issues that he was bringing on board. It might have been an exciting presentation, but let's also not forget that the issue of well-being washing he mentioned is of paramount importance. I open the floor for discussion, and I'll be so mean with time, considering that we still have another presenter. And in line with what Miles Jacob was going to do, or what he was doing, as you present, you jump. You stand up, jump, present, submit. The momentum has to maintain. Is that not so? Who wants to submit anything or react to his presentation? You're tired. So that refers also to the well-being of each and every individual in the house. We really need to reflect on the well-being, the physical fitness as well of all of us. I removed the part of jumping. Who wants to react to Miles Jacob's presentation? Okay, thank you so much. Silence means either you really understood, or you are confused, or you don't want him to delve in the other discussions as he was taking us through the presentation. Okay, I see a hand right at the back. Roving mic.
Ladies and gentlemen, change positions.
They are tired.
Thank you.
Thank you so much, DJ. Thank you so much for your submission. At least now you see the importance of being well at the workplace. It allows the room to have different kind of positive emotions as we deliberate on any other. That should always be the culture at workplaces. Comrades, allow me to call the other presenter. As Miles was presenting, the presenter was like, and I could also not look at the presenter because he was already shy. I thought his well-being as he was seated next to me was of paramount importance. So I also thought of not looking at him so that he also remained shy in his corner. So over to you. You can come and take over the presentation.
Everything. Okay, let me get this for Miles. Do you want your roving microphone? You can have this one.
No, I can stick there.
Okay.
Did you say it? You can't say Muzopamba. Muzopamba, and I said the social hazards. I open my mouth when I see the slides. No, it's fine. I know I can talk. Okay, so my name is Dr. Mzopambwa. I am a psychiatrist, and I'm a psychiatrist who has fallen in love with occupational health. So, one of the things that I have realized in our setting is that mental health still has some bridges that need to be built. It still has a lot of things that we need to remove and clear the ground so that we can all come to an understanding of the need to discuss mental health issues. Thank you for the slides. Where's that technology thing?
It went to the other room.
Oh, it went with the owner. Okay. So, all right, so I will continue and then say, my topic really is exciting for me because it's one of those miracles that I face every day in my career, where I'm supposed to be using the mind to study the mind and to treat the mind. That's one of the conditions where that combination is actually very rare. And so I'm happy that everyone who is here, you've got a job, you've got a work to do, right? So it has been found in general that mental health is more, or not just more, mental health is more of an issue that we all need to engage on, either at the workplace, those at home. No one should be left behind. So all of you are here because you've got a job, right? And it has been found that a decent job, it now depends what we call a decent job. A job, or owning a job, is protective to mental issues, to mental illness, right? So if you have a job, ask yourself, is it a good job? Otherwise, it may actually turn you onto the other side. And the other factor I want you to keep in mind as we discuss this is that about 60%, this is according to World Health Organization, about 60% of the world's population is at work. World's population is around 8 billion. So 60% is at work. And if the work environment is not conducive, we are killing the world. So this leads me to my objectives. Next slide. So today I need to discuss the following issues around this subject of psychosocial hazards in the workplace. What are the psychosocial hazards in the workplace? What is mental health? What are the adverse effects of psychosocial hazards? And what are the current trends of psychosocial hazards and management globally, locally, as we go? Okay, so every one of you has become so accustomed to hazards in general. And when you talk about hazards, so as we talk about hazards, most of you are well aware of biological, physical, chemical, and economic hazards, right? But of note is there is actually a small cancer which is growing in our midst, psychosocial hazards. It is a subject we all need to be comfortable in discussing, because they lead to mental health issues. And the challenge with mental health issues as we go is that, can you, next slide? So now let's discuss and try to define what are these psychosocial hazards. I think it's as you can see from the slide, these are factors in the work environment that can cause work stress, strain, interpersonal problems at work. So essentially we are saying these are just work stressors and job stressors. So these, they contribute to either physical or mental issues. I'll explain as we go. Can you go to the next slide? I need to dwell a bit on epidemiology. This is the general spread and the spread of psychosocial hazards world over and the characteristics. Now, I need you to appreciate that about 15% of the working age, this is according to World Health Organization in 2019, they suffer from mental disorders. Right? And globally, it has been found that 12 billion working days are lost due to the common mental illnesses, which include anxiety and depression. This contributes to 1 trillion. This slide is important to us to highlight that psychosocial hazards, mental illness, is actually more expensive than these physical hazards, which harm you immediately. Main reason is that recovery from mental issues takes long and is going to take your productive time. Besides taking long, it's very costly. So some economists at Harvard, they actually found out that per year, this is in America, 120,000 people die because of mental issues related to work stress. And related to that is about 180 billion is actually lost through healthcare costs. Not just that, there are also lost. There's also loss in terms of time or productivity, and the amount that you move too fast. About 150 billion is actually lost as productive time. One is going to get an off sick, and they're going to be off work. Just for interest sake, if someone gets depression, we treat depression for at least 6 to 12 months. But when you get a cut on the finger, we suture it. Next week you're back at work. Look at the cost in terms of time. It's a high time we now focus on psychosocial hazards in the workplace, as much as we also attend to the other hazards. Okay, so I've dwelled a little bit on the scenario of other countries. The African experience, unfortunately, we still lag behind. There are many issues involved: culture, stigma, poverty, right? TB is busy killing people, TB and HIV. So you realize that politically there's always an orientation to cater for those issues, hunger and those common illnesses, such that psychosocial hazards or mental illnesses, they lag behind because you don't see it easily. Physical hazards, you see them easily. Psychosocial and mental illnesses, you need that eye, that trained eye, that special eye that can look and then say, okay, there are issues here. But they are costly. That's one of our pitfalls in the African setting. However, many people, unquantifiable impact is actually happening as we go. Next slide. So this was according to, this is very recent, in 2024, in a study by A. Murray Iden. He actually noted that there are deterrences. There's a hindrance to mental health issues is mainly because of poor OHS or occupational health safety legislation. Some countries, they actually, just like Zimbabwe, actually getting to do better in terms of OHS. But in terms of OHS that focuses on psychosocial hazards or mental illnesses, we still have a lot of work to do. So what are these examples of psychosocial hazards? I'll just name just a few, as you can see on the slide. High and low job demand. I put the two. High job demand, so many working hours, a lot of work by one person, limited assistance, and also with low job demands, where someone spends most of his time idle at work. An idle mind is the devil's workshop, right? Sometimes it also predisposes to mental issues. Low job control. Most organizations, like we just realized, they're actually in the informal sector where there are no contracts there. And even when there's a contract, negotiations are always biased towards the employer because people want a job. And you can be fired willingly sometimes. These are the signs of these are some of the issues that show low job control. And then poor support and low clarity. One is given a job, probably informally, and they don't even know what to do and how to do it. That causes anxiety, worry, confusion along the way. And this can be helped by probably use of job descriptions, which is clear. Not just it being there, because sometimes job description is just a piece of paper. You have to make it that is clear. Okay. Then other issues include low reward. This one is straightforward. Poor organizational justice, interpersonal conflict and politics. Most of organizations, definitely, there are some issues and politics where there tends to be factions in an organization, and this worsens the well-being of employees. Then poor environmental conditions, traumatic events. Traumatic, it can be in terms of you being exposed to a traumatic event where an accident happens. This can predispose to what we call post-traumatic stress disorder. Let's go then, violence and aggression. With the violence and aggression, you realize that, imagine you're in the sales team, this can come from customers. They can easily be aggressive and actually violent to you. And now, in principle, we know that the customer is the boss, right? With that in your mind, you cannot actually be in a position to freely respond when actually exposed to violence and aggression. Then other issues include sexual harassment. I put that slide by purpose. In this case, who is the perpetrator? Who? Okay, I put that on purpose. Sometimes, yes, but commonly it's us, including bullying. Let's go to the next slide. Work-life imbalance. Sometimes work becomes so busy. Some work even follows you at home. For your information, it has been found in some studies that lack of social connectivity, lack of social life can cause death as much as someone smoking 15 cigarettes a day. So you need to give a boundary. This is home, this is work. All right? Then job insecurity, talked about that in organizational culture and leadership. Let's go to the next slide. So, like I say, these psychosocial issues, they actually affect your mental health. So let's discuss what is mental health. This definition I'll just give you as it is according to the World Health Organization. So it is a state of mental well-being that enables people to cope with stresses of life, realize their abilities, learn well at work, and work well, and contribute to their community. Essentially, we are saying it's a state of your mental well-being that allows you to function in all the disciplines of life. And it is a human right that we need to make sure that our employees and even ourselves have. It's a good thing that we are discussing this at a point where the World Health Organization has actually decided to zoom its microphone to the work environment. Tomorrow, which is 10 October, is World Mental Health Day. And the theme this year is it's time to prioritize mental health in the workplace. So that's a bigger political global shift to show that the workplace, where most of our population stays, is actually needs to be a healthy area and prevent collapse of the world. So let's proceed and then see the link within psychosocial hazards and mental health. Now, we talked about those hazards, and we talked that they've got potential to cause mental health issues. Now, those hazards, they can cause what you call stress. What is stress? Stress is just your emotional, psychological response to these hazards, right? And this stress can cause two types of harm to a person. It can be psychological and it can be physical. How does it cause physical harm? It causes physical harm mostly when you are continuously stressed over a long time, you produce stress hormones. One of the stress hormones is called cortisol. And when cortisol is persistently high, it's going to cause you to have high blood pressure, high cholesterol, high triglycerides. These are issues which cause what we call cardiovascular disease. So you may actually have a stroke, a heart attack, just because of stress over a long time. These are physical injuries. We also include issues like poor concentration can lead to physical, even accidents. Furthermore, in the next slide, we discuss the psychological effects of psychosocial hazards, which is my main discipline in terms of mental health issues. Okay, so the common mental challenges or the psychological hazards that can happen as a result of psychosocial hazards is that we may have stress-related disorders, we may have mood disorders, and also other substances. In terms of stress-related disorders, go to the next slide. In terms of stress-related disorders, there are multiple, what we call anxiety disorders, and also post-traumatic stress disorder. These three they are the commonest. However, there are also many others. Where you can have generalized anxiety disorder, this one is just persistent worry in multiple disciplines of your life. It can be at home, at work, and usually it arises after a traumatic or a work stress. If it's persistent for more than 6 months, it becomes a disorder. You can't help yourself. You need medication. You may also have panic attacks. These are intense sensations of fear. That may also be related to work stress. You have heard of panic attack, right? That he just fell down, having palpitations and other physical symptoms. Then post-traumatic stress disorder, obviously having observed a traumatic event, it can lead to stress, which is associated with the flashbacks. Next slide. Okay, in terms of mood disorders, the most common types of mood disorders are two: depression and bipolar. Depression is straightforward, persistent loss of interest and persistent sadness for more than 2 weeks, with other symptoms that can include low energy, reduced appetite, poor concentration, poor memory. All this tied together, they form what we call depression. That's what the one where I said we treat for at least 6 months. So prevention is better than focusing on the therapy, because the therapy is going to be expensive. Just seeing a psychiatrist in the private, it is expensive. I can't say the amount. You may need many sessions to see a psychologist and the medication on top of that matter. So mental health becomes an expensive subject. That's why probably priorities are going to the easier, cheaper options. But however, we are keeping a snake in the house, which is going to kill later. Then the other condition is bipolar affective disorder. It's also related to depression. This is someone who experiences extremes of mood. One moment is excited, very happy, very elated, jumpy, so much energy and all over. One moment is very sad, tearful, and crying. So this happens in the same person on different occasions. That's what we call bipolar affective disorder. Next slide. Then the others include burnout adjustment disorder and substance use. Substance that we can go to town. Let's go to the next slide. Right, let's talk about management of these psychosocial hazards and their dynamics in the workplace. So the World Health Organization, again, I keep on referring to them because they are the gold standard in terms of care that we give to patients. And they've actually come up with health strategies, which have got about 4 pillars: organizational policies, leadership training, employee support programs, and implementation of best practices for workplace health and well-being. Let's go to the next slide. Okay, I'm sure we still have time. But you guys were changing positions. Okay, so at the organizational level, we need to develop, my slides, the next 3 slides are going to be a bit condensed. We need this information. I couldn't summarize it any further. So we need to develop a comprehensive workplace health and safety program. This one helps to focus on psychosocial hazards with the policies, procedures, and resources to address them, especially resources. as management, as an organization, you need to avail resources. That's making a political decision to show your orientation. Then you need to provide leadership training on psychosocial hazards. Probably this is an unknown area where we need to teach more and have more of these sessions, more of these talks in your respective organization. Then also need to implement flexible working arrangements that do not really give much stress to employees, and provide employee assistance program. Can you go to the next slide? Then work design and management strategies. We need to optimize job design, ensure tasks are meaningful. So to make sure tasks are meaningful, challenging, and provide opportunities for autonomy and control. About challenging, a brain that has become accustomed to the usual does not develop, and it can actually predispose to stress. Right? It's as good as an idle mind. You've become accustomed to it. That's why we need innovative people in the organization. Then we need to reduce workload and deadlines. I'm not sure if the managers will agree with me there. Essentially, we are saying let them be realistic. Then promote clear communication and feedback. By definition, communication is bilateral. However, in most of our settings, it's unilateral, from the head to the toe. Nothing really comes back. So we need to correct that. Then offer opportunities for professional development. She gave a nice talk in the morning. She was a good example of someone who came from the floor up to the top. And so we need your organization to be in a position where you lift your employees. Don't be happy to see them holding the broom every day for years. Okay, let's go to the next slide. The individual level strategies need to equip employees with tools and techniques to manage stress effectively. Well, as part of your awareness programs, you are allowed to invite psychologists, psychiatrists, or even mental health practitioners to give you awareness in education. Information is important. Then I can't emphasize more. What you eat is what you become. The brain needs a balanced diet. If you give it sadza in the morning, sadza in the evening, every day, the brain won't work. It also needs vitamins and vitamin cache. Okay, let's encourage open communication and support. Let's go to the next slide. Okay, so the last on this is monitoring and evaluation. Whatever you implement, go back, look at it. Is it working? Is it the best practice? Where is it failing? Then you adjust. Next. This is just a summary of how this management goes about, where I said you need to identify psychosocial hazards first. You need to assess the risk. Some of the things that your employees may say is a psychological hazard, it may not actually be a hazard for everyone. So you need to consider that also. You need to you need to control the risk. Remember the hierarchy of risk control. Usually psychosocial hazards is usually around the engineering and administrative control measures. And also need to review and I talked about this. At whatever stage that you are, put the employee at the center. Consult them. They are the ones who are going to be implementing what you are going to be telling them. And hence, you meet resistance if you are going to be instructive or prescriptive. Next slide, please. Okay, let's just skip the borders and look at other countries. What are the issues trending right now in terms of managing psychosocial hazards? I never asked you, are you practicing any screening for psychosocial hazards in your workplace? Now I want to see how other countries are doing it. Now I'll focus first in the first world countries. So the most fashionable thing right now, Chirukupisa, is appreciating and recognizing psychosocial hazards in the modern workplace. If you do not acknowledge them, Wakasar is an organization. Because remember I said, it will kill you later. And it may kill many on one day. Unlike, okay, organizations are increasingly encouraged to address these issues. Apart from national laws and guidelines, collective bargaining and worker cooperatives are examples of methods. Let's look at the European Union, what they are. So, In 1989, they established what they call the 4 member countries. That includes addressing psychosocial risks. So by 19 to start looking at the psychosocial risks. Then several EU, let's go to Japan. So in 2015, they introduced what they called the employees. Right? If you're an organization, it's law. If you don't apply it, they have a legal duty to protect employees from work stress by implementing social hazard. Not all HS practices. It's further than that. Okay, next slide. In terms of regulation and providing formal guidelines for the assessment of occupational safety and health, total worker health program. This is in America. It realized that job-related factors such as social determinants of health. Okay, so we now have will and enforcement in terms of the law that arrests an organization for not doing a check on psychosocial hazards. We are trying, right? We are not yet there. Tichirukuita day na another day, but one day we will reach it. So recently, 2019-2023, there was an establishment of mental health strategies. Now there is recognition of the workplace, right? And this was to improve and increase access to mental health, psychological service, really to train mental health champions in each and every organization. In 2022, about only 35 organizations had actually adopted it, and one day. Next slide, please. So now, social hazards in the workplace. Is there a tool? Is there technology, right? So these are the ways we are going to be discussing the next slides. They are short. Next slide. So this first stage is very objective. What results? So here we use surveys and questionnaires. Examples of what is used in other places is they can actually self-administer them, or a health worker can actually administer them to them. So we put the job content questionnaire, which is widely used and identifies potential stressors. We also have the Copenhagen psycho employees. Everyone is going to, and then control them. Next slide. Or we can actually put employees in groups, usually groups of 20. Don't spend too much time in the offices. Go down the stairs that are there, or even the social aspects that are there, that are stressing your employee. You can get into a field, you will know, joining and data. You can make use of reports, those accident and incident reports. If you analyze them, you can see analyzing the observation ones. Then abnormalities and the turnover. In an organization where there's high turnover or quality, may signal signs of stress in the work. Always remember to prioritize mental well-being in the workplace. As it is play, at this stage, we need all hands on the table. The employer, the I didn't say that. All right, next slide, please. Thank you.
All I can say first is to say, wow. Doctor, all these are your potential clients. But what we are not sure is whether they can afford you. We are living in an economy that makes all of us to question our well-being physically and mentally. I don't wish to have been in any other group today apart from this group. Just relate from the presentation from Miles Jacob, Jumpy, illustrating, speaking truth to power through reality, and proceeding to the dog's presentation. Tapora Tesandisi. And this takes us to a realization as to, are we really okay psychologically? And without even summarizing much into his submissions, and cheaper than the therapy itself. And I'm asking myself whilst I'm seated to say, are we able to prevent it now? And definitely the big answer from the whole room is a no. Because these and many other are beyond our personal controls. The economic hardships are on us. We're going haywire. We just got our September salaries devalued. So we are all potential, or we are already your clients, Doc, not potential clients, because I don't think we are all okay upstairs. Colleagues, there was a presentation from Dr. Muzokomba. He took us through the dynamics and trends of psychosocial hazards and mental health in the workplace. Can we have reactions to his presentation? Can we have a roving mic that side to my far right? I'm no longer sure which one is my right. Miles was busy tossing me around. You can stand up so that the roving mic can access you.
Thank you very much, Jacob Miles. Thank you very much, Doc, for those insightful presentations. This is the tripartite negotiating forum where government is here, private sector is here, employee representatives are here present, captains of industry are here. We are talking about mental health issues. We are talking about the work-life balance. Sorry, I'm going to give a narrative. Narrative. We are talking about the work-life balance. Everybody is here present. Some of the issues that Jacob Miles, my dear friend, raised with the doc, esteemed doc, psychological doctor, I'm sure you're assessing my mental health as you sit there and it's a very potential client. My biggest question is, where are we heading to as a country? Some of these are preventable, but there was a stage where we talked about industry, where we have people and thinkers at the top, and then the bottom line in between. The doers or the thinkers, like Saungemo said, vanongo taura zvinhu. Then the big bosses, the captains of industry, some of who are here present, talk about the dollar value, which the doers are inputting. Where do we draw the lines as far as mental health is concerned? Because sometimes some of these issues are trivial, Doc, but like you said, zvinokura, build on, then it becomes a problem which becomes more expensive. Can we not have a forum, Tingori Panapa, where the tripartite negotiating forum is here present to deal with mental health issues, because they are topical and very pertinent if we are to talk of a middle income economy by 2030. I submit.
Thank you so much. Any other reactions? Over to you. Roving mic? Hello? I think I have two more here.
Okay. Thank you very much for the insightful presentation, Doc. I think mine is not a question, but I just want to relate your presentation to the presentations that we had.
Sorry, colleagues, can you please stand up? I don't want to leave here with a mental problem trying to locate who is speaking. I need to see the person submitting as well.
Oh.
I'm trying to look around. You can.
Oh,
Sure.
Okay. Okay. So mine is not a question, but it's a submission that is going to relate what he has said to earlier presentations. I think it's quite perfect that the soft risks that are usually ignored are actually coming on the table to solve. But I think it also goes on to the weaknesses probably that we may have either in leadership or in us as a group of OSH professionals. Yes, it may sound very, very new as in OSH, but you understand that we have been having standards that we're talking about risk assessments and even our laws. The good thing about our OSH laws are that while some may argue that they have been crafted in 1976 or before, but they don't expire because they were written in an open-ended manner. I thumbs up to probably NASA and those who were there when they were actually writing those. The moment the Labour Act talks about the right to fair labour practices, it's open-ended. The moment it confers a right to safe labour practices, it is open-ended. The moment the ISO standards, I think a good number of us here, I don't know whether the director certification for SARS is still here. The moment we talk about certification, I think we had a number of certifications that we were all having. There is a requirement for hazard identification and risk assessment. And if you look at that, you find that the clause on leadership, that was the clause on leadership that is supposed to also champion the process of ensuring that risks are identified and controlled. It talks about psychosocial risks. Actually, that standard puts in brackets bullying, harassment. They actually say even the style of management can be a hazard. But when you find now these auditors, or us as auditors, when we go to audit, remember he was talking about ethics in auditing and he was talking about competence, the competence principle as one thing that we need to have. People will always follow the industrial process and identify mechanical hazards, physical hazards, economic hazards, biological hazards, and they say the register is adequate. If you look at sometimes again from the regulator perspective, we have enforcement through the inspectorate. They always go there to check because their existence is in terms of the law and they have a mandate to check whether risks are actually managed. But when they go there, we have engineers, they are experts in mechanical hazards, experts in physical hazards, experts in certain areas. We don't have a Factories and Works Act that says except psychosocial hazards. We don't have a Mines and Minerals Act and its key regulations that says except for psychosocial hazards. I think it goes on to the limitations of professionals. We should think the experts like these people now should be there to actually nurture us, and we'll be able to say, after an inspection, after an audit, and we are saying we've done it ethically, the risk register is inadequate. For example, hazards related to job control or autonomy were not there. Rather than to say there were bed hangings, hazards related to explosives were not actually there. I think it has always been there, but it is the shallowness and the willing, the comfort in the old that we are living in that perhaps is leaving this gap in mental health. There is a standard that is called ISO 45001, yes, that has come. I hope SAZ will actually also spread it. It has been published in 2021, and all the certified organizations can actually use it. Thank you so much for the time.
Thank you so much. We'll also ask for an extension of this grouping so that we also have to hear and discuss around many other issues that might be burning in the House. Can we also be on time as you submit, because we don't want to be in between this session and also your timing to go for dinner. We want you to prepare and put on your African attires. Over to you.
On compensation. Today, we have some claims on psychosocial hazards, like people who suffer depression as a result of workplace hazards. And also, if we do have claims submitted to NASA, how many do we have claims that were honored, that were paid off? Or where are we in terms of compensation?
Thank you so much. I see no hands to further react to the presentations that happened. And Doc, I think there is one question, two questions. The first one, I'm not sure if you've been assessed space to respond to it, but if you see it fit, you can proceed. Where are we heading to as a country? Looking at what is currently obtaining. It's within your profession that you also add up to the issue. And the second question, which I also want to try and say, the previous submitter who made a comment was also clear on the gaps that are already existing in all the statutes that are existing on psychosocial hazards. So I will also leave it to Doc for him to further explain on the gap on compensation on psychosocial issues, but also taking cognizance of the submission that have been made by the comrade seated in front. Over to you, Doc. You can come here.
It's fine. Okay, so I wasn't assessing you, I was listening to you. So your question was, where are we as a nation? We're exactly where we are. Okay, so when I look at it, I look at where are we supposed to be versus what we are doing currently. In terms of where we are supposed to be, I gave an example of Japan and other countries where they've got screening tools that have been adopted by their government that is administered by every organization with more than 50 employees. And I gave a few other examples of tools that can be used. So that would be best, those are the best practices for us to make sure we don't miss these psychosocial hazards. And unfortunately, as a nation, yes, the laws have been written long back. They are there, some of them are open-minded, but practice on the ground in terms of conscious decision to decide and look for psychosocial hazards, that's what is lacking. And the only thing that is there for now is more of these promotions in terms of mental health, but there's no serious enforcement in terms of law. Like I was saying, if in other countries, if you don't do that screening, you're actually arrested. But here we don't, maybe some are doing, but I know in terms of risk assessments, most of our organizations, they focus on the physical, economic, chemical, biological hazards. But in terms of this one, it's a gray area, left to chance. Now, just to try and understand maybe from the government's point of view is that in terms of manpower, these are jobs that are usually done by psychiatrists. And unfortunately in Zimbabwe, we only have 25 psychiatrists to deal with about 15 million population. That's not an easy task. And however, other professionals in the sector can be engaged, but the level will be different. So, take-home message for me will be, thank God I'm also the Secretary General of Zimbabwe College of Psychiatrists. Some of this information we can lobby as an organization to the government to say, We have got organizations that have got employees this amount, and we need to make them focus on psychosocial hazards. That could help mental health issues. As long as information and data is availed to the government, I'm sure they'll give an ear to our concerns. The other question was, I think I've covered everything.
Thank you so much, Doc. And I'll also give Miles to give us one last parting shot of his presentation as we... There it is. It's working. Just switch it on.
Okay, it's working. Right. Do you want to be standing next to me?
It's all right.
Okay. Right. So as far as mental well-being is concerned, there are basic things that we are not doing as a people. Number one, everyone stand up actually. Stand up, stand up, stand up, stand up. I don't talk to seated people. Sitting is the new smoking. Stand up. Look at the person next to you. I want you to sit, get in pairs. Look at the person next. Look at each other. Get in pairs, quickly. Hey, you guys here, go and look at that quickly. Stand up, dog, stand up. Look at someone. Look at them. I didn't say look them seductively. Look at them. Right. Rule number one. I remember when I was doing my first degree in the UK, people actually thought I was not right in the head. Because I greeted everyone. Hi, good morning. That's where mental health starts. Good morning, say. Good morning. Say hello. I want you to greet the person you are looking. They must feel that it's not just good morning or good evening. I didn't say touch them or hug them. Right? Greet them. Right, stop. Number two is the medication. Simple, basic things. It doesn't matter even if your teeth are yellow. Everyone smile. Quickly, quickly, smile, smile, smile. Stop. Number three, say please. Number four, say excuse me. We don't go bulldozer. Those are basic things. Do those basics. Chete. Everyone touch your heart. We're finishing off. Close your eyes. If you continue, don't open up. Ask yourself this, and for your colleagues, if I continue doing what I'm doing right now, eating what I'm eating, drinking what I'm drinking, treating people the way I'm treating people, where will I be in 10 years? What destination? You are going to arrive at a desirable destination or undesirable destination. Driving a car you don't like, married to the person you don't even love, living in a house you don't even like, at a job you don't even enjoy. In 10 years' time, if I continue what I'm doing, where will I be? Open your eyes. Mazona. Touch your heart. Finishing off. Repeat after me. I and I, being of sound body and mind, promise on this lovely day to get checked and tested as many times as possible, and to encourage my colleagues and fellow employees that my health is my wealth. Clap your hands.
Allow me to thank you all for being very active participants in this group. And before I also allow you to clap hands for me to be the first moderator and chairperson for the session, I would want to give a notice. Someone lost a cell phone. So if you are nowhere close to your cell phone, kindly see Dr. Mugaviri. For those that do not know Dr. Mugaviri, if you are amongst those that lost a cell phone, whether it's joint or it's an individual one, you can ask any NASA representative outside. So now you can clap hands for me. And thank you so much for being the best group. Let's introspect as always, and also let's be brother and sister keeper for each and one of us. Thank you so much.